Thank you very much. Thanks, Professor Azzoni, for kind invitation to this conference to show what are the first results of pilot studies in this type of technology. Because my previous orator, Francesco Gionni, spoke about the technology, and now we spoke about the application of this technology, our pilot study, our experience in this type of innovation. Please, the next slide, please. We spoke that medicine traditionally was the challenge with the patient, but now medicine is also the challenge with other colleagues in the healthcare system. And so we spoke about that. We began our experience, as we showed in the last our publication just this year, about our experience in telemedicine and e-health. We began in 1996 about the trainees of a vitreoretinal surgeon in a critical post-war Bosnia to support them in vitreoretinal surgery by a satellite link. That was the first possibility of connection with this critical environment. Next slide, please. But no, after this experience, we developed the different types of experience and application of technology, in particular on the web-based platforms, on the database management, and on digital monitoring of medical care. In all of these applications, we use a neural network, machine learning, and nowadays the artificial intelligence. Okay, in this slide we can see our experience detailed in 4 different points that I will show in the next slide about the information technology support, about the medical databases in clinical and follow-up studies, the e-health for increased quality in medical care, and is one of the points that we have to speak here in this UN headquarters, and also the web-based platform for medical education. Firstly, the information technology support was our project developed from 2014 to 2015 to support ophthalmology in outpatient setting. How? By a web-based tablet application for a follow-up in age-related maculopathy. We involved 12 Italian centers, as you show in the map, and you can see on the right image, by an application we can insert data, clinical data of patient. We can immediately have the possibility to refer to the hub center for the therapy, but as well as a score based on therapeutical indication to understand if the patient was stable or critical for a therapy. But another experience, more large, was about the medical databases in clinical studies. First experience was to collect data for rare ocular disease by a nationwide ocular disease centers that collect data about a genetic alteration in a young patient, to collect data from different centers, few cases from different centers, make a big database to understand the natural history of the pathology for future clinical trials. But also not only rare disease, but also experimental studies, in particular for histology. We connected data from clinicians, geneticists, biologists about histology of the retina to study on a web-based database to connect data, to unify database with input filters for a share of image and data, and so to progress with our research. Another important experience on medical database was during the COVID-19 pandemic, where we connected data from ophthalmologists, infective disease units, microbiologists, and genetic laboratories to study, to evaluate with the support of artificial intelligence the possibility of the spread of this pandemic. And we discovered in this publication that the virus was present also in the conjunctiva, so to understand and comprehend better the possibility of the diffusion of this pathology all over the world. And this was a project developed between 2020 and 2021 during the most effect of the SARS-CoV-2 pandemic. And lastly, not only public company, but also private company could have a role in this type of researches and this type of application. In particular, we involved the airport society that manage the Milan airports, because in a project of screening workers to understand the epidemiological data, a web-based application to collect data and to understand the risk factor for this type of workers. And so here I underline the role not only of public, but also the role of private company in support this type of projects. Moreover, the importance nowadays, in particular in developing countries, but also here in Europe and the United States, the role of chronic disease and anti-aging medicine. We will listen to Dr. Bauchet in the next presentation about the collection of data for chronic disease to understand what are the risk factors, what are the therapies interaction, and here artificial intelligence could have a role for the management of the therapies and to reduce the clinical burden in evaluating and monitoring this type of patient when the chronic disease represents the real future burden for health system in our world. But not only chronic, but also not only databases, but also e-health for increased quality of our medical care. We describe here our project that is incoming and is working now from 2023 in Madagascar, supported by a no-profit association for a surgical support, but also teaching for medical care here in these villages in Madagascar. In particular, not only surgical, but also clinical data transmission, as you can see in the image, where the physician collects photos of the pathology of the patient and send it by a web-based platform for a second opinion and support, all to increase medical support and health quality in this critical situation. Telehome care, not only imaging a second opinion, but also a control and monitoring of the patient from far by wearable devices in the patients, but also a control like our proposal for Horizon project to evaluate and monitor patient at home, sending data to the platform for one side, a reduction in hospital burden, and on the other side, an immediate possibility of intervention in case of automatic alert system, in case, for example, or a reduction in the saturation, in blood saturation in patients with pulmonary diseases. And this is a project that is working now in different areas. Lastly, I spoke about teaching, I spoke about learning, and this project, a web-based platform for medical education. You see Italian residents and fellows that connected to their teachers in different centers could send images, could send brief description of clinical case, and at distance, the teacher could solve this problem, could discuss this evaluation, like you can see here in the video where a fellow is taking some photos about the imaging of the retina and sending the image to this teacher for a consultation, for a teaching, for a possibility of revision of clinical case. It was a very good and interesting experience. But what I said just in my presentation, please, next slide, is a description of the pilot study that actually are working, others are stopped, as Professor Azzolini was telling before, for the necessity to have funds, to have the sustain of the public administration, not only to see some pilot that finish after 1 year or 2 years, but to have the possibility to sustain this project, to increase really the quality of healthcare, not only for physicians, but for all the operator, and finally for the population, the patient, and not only like the experience that I sent to you, that I described to you, but are finished like a simple scientific publication. Thank you.